Today I will be presenting Uninsured Americans' Health Disparities by Rigo Salazar. Background information. Health is unevenly distributed. All of the following factors cause health disparities: socioeconomic status, educational achievement, occupation status, income, race, access to healthcare. These factors entwine and they influence the access to healthcare and consequently can cause Americans to be uninsured. Uninsured Americans. An uninsured American is an individual who does not have medical insurance. Despite federal efforts, around 87 million people were uninsured in 2018. Minority groups are largely affected. Socioeconomic status is the leading factor that distributes to being uninsured. What leads Americans to be uninsured? Cost of insurance is too high. Not aware how to reach out to programs like Affordable Care Act. Not all jobs offer healthcare benefits. Income deficiency, loss or change of employment, low healthcare literacy. How are uninsured Americans affected? Uninsured Americans receive low quality health care, which affects their quality of life. Uninsured Americans do not get effective preventive care. Uninsured Americans fail to get adequate care for their children. Detrimental outcomes. In general, uninsured Americans have lower life expectancies when compared to insured Americans. Child health. Greater risk of death from infectious disease. Adolescent health. High rates of pregnancy, high rates of STDs, adult health, high rates of death, high rates hypertension, diabetes, cardiovascular disease. The different factors that affect health outcomes. Many of the costs can be broken down into categories: voluntary factors, involuntary factors. Voluntary factors are behavior that a person can control. Involuntary factors are not within the person's control. Voluntary versus involuntary factors. Voluntary is smoking, diet, lack of exercise. Involuntary, language barriers, genetics, living and working an unhealthy work condition, limited or no health care. Preventable disease within uninsured Americans. Uninsured Americans face preventive health problems that can potentially be avoided if treated on a timely manner. Asthma, diabetes, high blood pressure, and cholesterol, immunization conditions. Which minority is affected the most? Hispanics were most likely uninsured compared to other minorities. Undocumented immigrants are not accounted for in programs aimed for helping the uninsured gain coverage. They are not eligible for federal aid programs. Legal issues prevent Hispanics from, such as being undocumented, play a pivotal role in what is being done to help uninsured Americans. National programs like the Affordable Care Act and the Patients Protection Act were designed to increase quality and affordability of health insurance. Community health centers often offer health care at lower prices for uninsured Americans. Various programs are still developing in order to provide low medical care. Advocates are raising awareness to this nationwide dilemma. Conclusion. Uninsured Americans have lower life expectancies than those who are insured. Children and youth are severely affected when their caregivers fail to provide health insurance. The objective is to help lower the rate of uninsured Americans. Specific policies should be developed to treat undocumented